everybody. Welcome back to the show. Cameron English here with you, Director of Biosciences at the American Council on Science and Health. And I'm joined again by Dr. Chuck Dinnerstein, our Director of Medicine. Chuck, how are you?
I'm good, Cameron. How are you doing today?
I'm very excited. I'm a dad and I have a little bit of free time to myself today. It's revolutionary when you get to experience your pre-child life for just a little bit.
Yeah, you don't get used to it because he'll be back.
Oh yeah. Yep. It never ends. It never ends. But I love it. I love being dad. It's great. But let's talk a little bit about some science. And we've got two really interesting articles today. The first one you wrote, it's called The Impact of NYU's Match, and it's about free medical school, at least for some future doctors. So we're going to get into that, and we're going to talk about a story I wrote about why blueberries are not a miracle food and they're not going to prevent dementia. At least we don't have any evidence that's going to happen. So we're going to take these in turn. Tell us about your story, though. What's going on here?
Okay, so with great fanfare 4 years ago, NYU announced that medical school would no longer cost the medical students any money. It was going to be tuition free. They had arranged with their benefactors to create a $750 million endowment, which would pay for medical school forever after for their students. And the primary reasons that they did it were to get rid of the debt that medical students had when they left school so that they would begin to choose careers that were not necessarily driven by finance, but more driven by their passion, meaning that they expected to see more people moving into the areas of primary care and in serving in the underserved urban, suburban, and rural areas of the country. So the first graduating class under the free tuition plan graduated this year, so I thought it would be interesting to take a look at it. Now, the first important caveat about all of this is that the students that were selected for that year did not know it was going to be free tuition until the first day of school. So they may not have selected or attracted the people they would be most interested in, but I thought that this was at least a good time to take a quick look and see how things were going. And the free tuition resulted in several things. First of all, it reduced their educational debt significantly. They reduced their educational debt by about $200,000 each, which is a lot of money. So from the point of view of reducing their debt, it worked very well. There's very little information available on the racial and ethnic breakdown of the class, but I would suspect that it's pretty much in line with the way they've been all along, which is a pretty diverse class. So I don't think that there's been any significant changes in there. But in April, the graduates all matched for various residencies. And that's where you start to see some of the data showing up to suggest whether there are real changes or not. And what I found was that in the areas of primary care, there was a slight uptick as compared to the national average. But overall, the class of 2022 was still choosing high payout surgical and medical specialties. So there really was not a significant change there. The other way I looked at it was where they were going to do their residencies, because about 60% of doctors stay in the area where they do their residencies. And 60% of the class stayed in New York City, another 11% stayed in Boston, 5% stayed in Los Angeles. So very few people wound up going into residency training in suburbs, let alone in a rural area. So in terms of free tuition nudging doctors in a different direction, it certainly doesn't seem to have worked out, at least in the year one of NYU's free tuition. And I think that it really comes down to the fact that all of the medical schools, where we're talking about very low acceptance rates, 2, 3, 4, 5% of acceptance for the classes, are made up of highly competitive individuals. And that it's very difficult to expect that these highly competitive, intelligent individuals will necessarily want to move and raise their family in a place where there are less cultural opportunities, less educational opportunities than they already have. And I think that that's the real Achilles heel of all these attempts to redistribute primary care physicians throughout the country.
So it sounds like they showed up and they got a hell of a back to school present. And then most of them went on with the plans that they had. And I'm not criticizing anybody for that. I think that's human nature. You just
Oh,
follow
absolutely.
the path of least resistance to the outcome that you want. So maybe, and I don't know how you would do this. I mean, the system is so complex and interlocking and all that, but it seems like you would need incentives that would say, if you go practice in this rural part of Alabama, then there's a particular benefit attached to that. Or if you go into this sort of specialty, there's some sort of financial or professional incentive for doing so. Is that possible? And would that
Well,
work if it were?
that was the big argument that the opposition made at the time of NYU's announcement, that this kind of across the board free tuition was not sufficient, and that if the residents were to choose going into an underserved area or to choose an underserved specialty, then they should see their tuition eliminated. Problem with that is that people, it's like the public health services that's more than willing to go and work for a year or two in an underserved area, but then they're going to go off to resume their lives in the places that they want to live, which just means that the underserved areas will be receiving more in the way of care, but they'll be receiving less continuous care as there's this continuous turnover of people coming and going, which is better, but certainly not the best situation you'd like. I think that you have to start recruiting more from areas that are already underserved. And there's no evidence that free tuition in and of itself is going to make that recruiting effort go better. It'll certainly eliminate the cost considerations, but it won't help them identify the people that they want and then expect them to go back to those areas. I mean, if you think about someone who's done now 8 years of college, what's the chance that they want to go back to a situation where there's no cultural activities except the local theater, the local movie theater, and that there's few educational opportunities for the kids. Now, when I lived in central Pennsylvania, there were certainly a lot of physicians that liked to go hunting and fishing and loved living in that outdoor environment. But that was they chose that path not because of some financial incentive or disincentive. They chose it because that's the kind of life that they wanted to lead.
That's so fascinating to me because I don't think effectively anyone really thinks about, these kind of sociological factors that influence the kind of medicine that someone practices and where they practice it. Because I don't know, the way it looks to me is like when we think of scientists and we think of doctors, we think that they just live in this like academic bubble, and all they do is medicine and all they do is work in a laboratory. And we don't think about the incentives that might drive their work. And maybe if we did that, and this is at a societal level or a policy level, we would get better results. Does that make sense? Does that question make sense?
Yeah, I think that you have to take into account where people want to go and what they want to do with their lives. There's more to their life than simply doing medicine. And even though one of the spouses is a physician, that isn't necessarily the case for the other spouse. And they get a big vote and where people wind up living. So I think it makes a big difference there. And the other thing is, I think we have to have a little bit more of a conversation about primary care. And I know the primary care people that are MDs may disagree with this, but a lot of primary care can be done at this point by advanced nurse practitioners. And we may find that that's a population that is more comfortable living in some of these other areas. Now, they may not, but they very well might, and it might represent a group that we can look to as we continue to redefine what primary care is. I think that a doctor trained at NYU who goes on to do 2 or 3 years of primary care may find that working in a rural setting is more confining than they thought. Let me say this: for the few years that I spent working in central Pennsylvania, and I was at the end of my career, so I didn't have as many concerns about developing experience and developing judgment because I already developed a lot of that during the period of time that I worked in an urban and a suburban environment. I was the only vascular surgeon around. There was nobody to turn to talk to. There was no mentor. There was no you were professionally isolated in a way that I don't think we think about and appreciate. And it's tough to work as a professional without some people to bounce ideas off of, or people that understand how work is going, any of those kind of things.
Yeah, I'm glad you wrote this. You know, I was telling you just before we started that I hadn't considered how interesting this would be, but it seemed, I mean, you know, the technical medical questions, we always have to focus on these, but these broader cultural issues are important. Just a final question before we move on. You have a graph in here that depicts the average medical school graduate debt over time. And it
Yes.
looks like since 1978, it has exploded. And this is whether you look at inflation adjusted dollars or not. But in 2018, the average debt is over $215,000. So I'm sure there's a variety of variables that go into this, but why such an explosion in the cost of medical school? What's going on?
Well, it's the same that you see with tuition going up everywhere. Um, Schools are competing for candidates on more than their education. They're competing on the basis of their amenities. They're competing on the basis of the social environment that's there. And a lot of those things cost money that get built into tuition. There's also the fact that the states have cut back on the amount of money that they're giving to state-run institutions, and that more and more people are attempting to get into college and in medical schools. And so there's increasing demand. The supply has not grown exponentially. And part of this is that even though the first 2 years of medical school are really pretty much book learning, the last 2 years of medical school are on the job training. So it's very tough to add an extra 15 or 20 students into a hospital because there is no, as we would call it, clinical material, and you would call it patients to care for and to take care of, to learn from. And it's you can't share patients. That's not a good way to learn. So these are all things that continue to drive the cost of school up. When I think about what it costs for me to go to school and what they're paying now, it is mind-boggling. The only frame of reference is the cost of putting my two sons through school, which was also mind-boggling.
Yeah, it's a staggering amount of money. And the point you made about competing on amenities, I don't know if this is true for medical school specifically, but I remember reading Thomas Sowell's book, Economic Facts and Fallacies, and he talks about how the rankings for universities and colleges actually factor in how big's the swimming pool, how many gyms do you have access to, do you have a state-of-the-art cafeteria? Like these sort of things actually can make a school look like a better choice to a prospective student.
Yes.
And yeah,
Go
go
ahead.
ahead. No.
Well, and NYU covers their tuition. It doesn't cover their room and board, and they're renting in New York. This
Oh,
ain't cheap.
right.
Even with the tuition assistance, they're still racking up costs to be there. But after all, it is New York City. There's a lot of things you can do.
Yeah. That's so fascinating. I keep using that word, but just something to consider, everyone. All the things that influence how and where doctors operate.
Hopefully, we're
But
going to go back and take a look at this next year and see whether there starts to be a change. We'll see.
yeah, I would be curious to hear that follow up. But in the meantime, let's talk about blueberries, Chuck. I do enjoy a good handful of blueberries, and there's all kinds of nutritional benefits to them. But I've been seeing, and there's one author that I've been following that she writes for CNBC. She's a nutritional psychiatrist, which I didn't know was a specialty, but apparently it is at Harvard University. And she's been writing these articles, these kind of listicle stories, 5 foods to avoid if you want to keep your brain focused and sharp. And I think we took that apart on a previous episode of the show. But a couple weeks ago, she wrote an article specifically about blueberries and how they can help prevent dementia, which is a really appealing hypothesis. If you can just crack open a frozen bag of blueberries or get a little carton from, the grocery store or whatever, I get why people would want to believe this because it's, they're blueberries. I love blueberries and they're going to, keep me focused and all this stuff. But when you dive into the data, you don't really see any support for this. And so it goes back to that old, this old point that we talk about a lot is that, the academic research or the medical research, it doesn't match what the public is being told the research says. And so I think it's worth diving in and trying to explain that, obviously a balanced diet is important for your overall health, including your mental well-being. But the idea that there's like a magic food or a miracle recipe you're going to follow, and when you're, 96 years old, if you make it that far, that you're just going to be as spry and excited as you were when you're 37. I find that a little unbelievable. So do you have any general comments about that as a physician? And then we can kind of break down some of the data.
Part of it is that continued attempt to take a holistic problem, our diet, and break it down into its little component parts and expect that when you put the parts back together again, you'll achieve the whole. And that's just not the case. It's far too reductionist. I mean, when we get down and dirty into her study, she was able to show in some of the original work that there was an association between prevention of dementia and the flavonoids. And the blueberries are packed full of that. But it also required exercise, not smoking, a reasonable weight, all the other fellow travelers that we've gotten to know. And so to simply focus on the blueberries is just not good science. But it does meet the requirement of what you had said earlier on. It is perfect for a listicle. And that way you can just zero in on something. It's a nice piece of clickbait. You read it. They put up the ads, and then you move on.
Yeah, as a piece of media, it's especially helpful, and I'm sure they got a lot of viewers or a lot of readers from this. But just as a scientific matter, it's I don't know if embarrassing is the right word, but it's just so flawed that it frustrates me that people take it seriously. It's kind of like saying, in a neighborhood, if crime goes down, people call the police less often. Therefore, calling the police less often reduces crime. I mean, we
Right.
would look at an association like that and instantly everyone would go, well, that's obviously stupid because the crime goes down and then they call the police less. And we see these associations all the time and we recognize that we should not infer causation. But then in epidemiology, they do this all day and over, and the reporters cover the stories very gullibly, I think, over and over. It's just fascinating.
Well, and to be fair, we're talking about blueberries that you already admitted that you love. So if I can give you an argument about why blueberries are good for you, I mean, why would you want to attack a blueberry?
I know.
It's done nothing. It's just sitting there very quietly, waiting to be eaten.
I know.
I think that people take advantage of that. It sounds like a perfect thing. Now, you can find the similar kind of flavonoids in red wine, but she's not telling you to drink a bottle of red wine a day. because that has a different cultural gist to it than the blueberry, our friend the blueberry.
Right. These days I'm more of a raspberry guy, so that could be what prompted me to write this article. I'm in big raspberries pocket these days.
It could be a bias, an unconscious bias on your part. Now, there's one other thing that I enjoyed in there is, we've been all talking about food frequency questionnaires, and this week for the first time I got to fill out a food frequency question, and I would have to say that if people are as attentive to filling it out as I was, they are completely unreliable. Completely. How many servings of grapes did you have last week? Well, first of all, nobody told me what a serving was. And, I can barely remember yesterday's meals. Maybe that's my age, but I certainly can't remember how many servings of grapes that I had during the week. So I've always thought that those questionnaires were a little circumspect, but when I filled it out for myself this week for a research study, I said, there's just no way. There's nothing I'm telling them that I can show is actually correct.
Yeah, it's crazy. And it's funny you bring up your own experience, because I was going to do the same thing. I have, in recent months, since my son was born, I'm putting more emphasis on working out consistently, and I'm monitoring my diet very carefully. Mm-hmm. And it's really difficult. I mean, I have an app, and you put in all the information and it says, here's the macronutrients you need. Here's how many calories you need. And it moves in real time with you based on what you report. And I know as I'm doing it, I'm doing it accurately enough to hit my goals and to lose the weight I want to lose. But I know when I measure out a cup of raspberries, for example, I know it's not a perfect measurement, right? Some fall out the side. Maybe it's a little more than a cup. So over time, I'm misreporting what I'm eating. Now, it's not enough to stall my goals. But if I was doing a research study like this, it would probably be enough, especially if it's multiplied by 2,000 people. It would be enough to distort any result you get.
Right. And I would argue as a physician that the chance of one of my patients telling me how much they actually drank is almost zero. Because once a woman has more than 5 glasses a week, she's an alcoholic. That's the definition, baby. And so I'm always going to come in. I actually only have 1 glass a week. It's a 42-ounce glass. So, but so not only is it tough to recall what it is that people make up answers so that you don't think any more ill of them.
Yeah, we talked about that. Yeah,
nobody wants to be listed as just having hamburgers all the time and occasional blueberry to keep from the dementia away.
Chuck's got some zingers today, everybody. In all seriousness, you're making a good point, and they talk about this in the paper a little bit. And to their credit, they reported this. Not every researcher reports these kind of deficits in their work, but they pointed out that they had to exclude certain people as the study went along because some of them just stopped filling out the frequency questionnaire. So they would show up to their annual exam. They'd be like, yeah, I just didn't do it. So you have no data, but then I think more importantly in this case, you're looking at a group that has an elevated risk of dementia because they're aging. And so if they get officially diagnosed, then you have to exclude whatever they report because you can't trust it. So talk about both of those. Those are interesting.
Well, it's true. I'm creeping closer to dementia. I suppose that is correct. But the recall is very tough. It gets even worse when you have dementia. And then when you're missing data sets, it becomes another statistical uncertainty how you place that data back into the study. And I believe that there was also some people in that study who reported eating not enough calories to actually continue to survive.
It's from NHANES, I think, is what you're thinking of.
Yes, and so overall, I think that it gives you a general sense of things, and I think your conclusion was, blueberries are fine, but it's not going to,
Yeah.
make
Yeah.
you a 90-year-old Einstein. And to be mean to somebody else while I'm on the topic, it probably is certainly no worse than taking Prevagen. You know, it may actually be better for you.
Who knows? And see, this is the thing. People, I got some hateful comments for this story, but people have a hard time separating the analysis of what the evidence shows versus what may actually be the case. So it could be that a fistful of blueberries a day might prevent cancer and make you 2 inches taller and boost your savings account, whatever. That's all possible. But if we can't show it, then we can't give people advice, or at least we shouldn't give people advice. And even if you take these results at face value, none of them were statistically significant. So you don't even know if the association actually holds, assuming that all the other stuff we covered is wrong. you know?
Right. Well, exactly. But again, if you're a scientist looking to promote your work, if you are a scientist that's on the media, look how well it worked out for them. We just spent the last 15 minutes talking about blueberries.
Well, you got to do what you got to do, I guess. And I try not to look at this stuff too cynically, but I can't help but see, there are these incentives in the way the system works. Everyone acknowledges that it's bad and that it doesn't help society, but we nonetheless, keep keep doing
on
it.
down
So
the same road. Exactly.
yeah. Anyways, all right. Well, there you go. There you go. That's what's going on in the world of free medical school and the nutritional benefits of blueberries. Hopefully you all are just a little bit smarter from the show. If you want to follow along with the articles that we're talking about, just go to our website. It's acsh.org. There's a button at the top that says subscribe. Punch in your email address. You're going to get our weekly dispatch emails. And that's where we draw the stories from that we talk about. It's the stories that you're all reading. So sign up and join us next time. Again, thank you so much, and we will see you then.